Now, Zimbabwe has now officially entered a hard lockdown. This measure has been taken to manage the spread of COVID-19 in that country. All business activity will be closed for the next 30 days, except for essential services such as hospitals, pharmacies and supermarkets. For more on this, I'm joined by ZANU-PF South Africa spokesperson Kennedy Mandadza and Zimbabwe Communist Party spokesperson Bongani Mkhwananzi. Gentlemen, a pleasure to have you both on the program this evening. Kennedy, let me start with you. Now, Zimbabwe has implemented a hard lockdown. However, it seems there is still this growing sentiment in the country that another lockdown is not necessary, as this would have a devastating impact on the country's economy and Zimbabweans in general. What's your assessment of the situation in the country?
Thank you so much for inviting me on the program. We want, first of all, to commend the Minister of Health for introducing or renewing the COVID-19 lockdown restrictions in the country because of the unprecedented spike that was witnessed during the last few weeks. The number of people that were infected or contracting the COVID-19 virus has been on the rise, including the number of deaths, and they saw it prudent to introduce the hard lockdown restrictions so that they can curb the spread of the virus. And it is important to note that while it is important to ensure that the economy grows, it is important to save the lives of the people. And it is on that basis that the Minister of Health and the government saw it fit to reintroduce the lockdown measures, which seek to curb this resurgence of the coronavirus, which is now attacking people of all ages, unlike what we saw in the first wave. So it is important, therefore, for the government to ensure that they create an environment in which the spread of the virus is kept. On the other hand, they are cognizant of the need to grow the economy. That is why essential services and the manufacturing, mining, and the agricultural sector have been given the leeway to continue to operate in order to ensure that whatever we seek to achieve in the country is maintained. So we would want to commend the government for for prioritizing the lives of the people.
All right. Mr. Mkhwananzi, I want to bring you in as well. So these measures that are being implemented by Zimbabwe's government have also come under some criticism, with many saying that these lockdown measures are not necessary, as they have a devastating impact on an already strained economy and would also have an impact on ordinary Zimbabweans. Do you agree with the sentiment?
Well, that sentiment holds a lot of water. The majority of Zimbabweans are in the informal sector, with estimates of up to 90% working in the informal sector. That means these are people getting by from hand to mouth. Once you lock down the economy, essentially, when you lock down people and say there should be no movement at all, etc., it causes them not to have an income. So while you think you'll be saving them from COVID-19, you are subjecting them to hunger, and essentially people break these COVID regulations and this lockdown. So when you look at it, it feels like it was a bit of a copy and a knee-jerk reaction without analyzing the situation on the ground on how people are actually sustaining themselves. And when you really look at it, if you look at the crisis at the South African border and with the Zimbabwe at Bay Bridge, you will see that people are emigrating and flocking away and running away from those sort of lockdowns because there's no means of sustenance for themselves.
Mr. Mandaza, I want to bring you back into the conversation. Now, you represent the ZANU-PF, which is the ruling party in Zimbabwe, and you speak up, and already we've heard about these concerns being raised about people desperately leaving Zimbabwe seeking better opportunity. But just also talk us through some of the challenges that have inspired this lockdown.
What we have seen, like I've already indicated, the reason why we have had the lockdown restrictions introduced at the level that they've been introduced is the increase in the numbers that have been witnessed in the last few weeks. And it became necessary for the government to institute these measures so that we can curb the spread of the virus. Because as you all know that many people try to take their living by going out each and every day. And in order to make sure that we curb, we have to restrict the movement of people, particularly those who wander around in cities many times, while it's acknowledging that our economy is predominantly in form of at the moment, we also would want to make sure that we serve the lives of these people. And if we are going to look at the numbers of people that are living in the country at the moment, this is not necessarily new people that are going into South Africa or any other country, but these are people who had come to Zimbabwe to see their relatives during the festive season, and they are now trekking back to the places where they work. And it is because they feel that if the lockdown conditions are going to continue, they may not be able to go back to their places of work. And they are not so sure of what is going to be introduced in the countries where they are going. So there is a bit of a haste and panic among many of them, but these are not new people that are leaving the country. They are people who had come to visit the country in order to see their relatives, and now they would want to go back to beat initially. They wanted to beat the 5th of January, which is the day on which the lockdown restrictions started. So we are not really surprised by the numbers that are going to the border, although it could have been better if the lockdown measures had taken some time to ensure that the flow of people is controlled.
All right. Mr. Mkwananzi, I want to return to you. So I want to get a sense of the situation on the ground. Health experts are warning of a rapid rise in new infections, especially in the most popular suburbs where social distancing is almost impossible. Talk us through what the situation is on the ground in Zimbabwe.
Well, I was in Zimbabwe this past week. The situation is as would be expected in a country where a lot of facility is not there. For instance, when we say people are crowding, etc., I feel there's not been, people have been following the regulations that have been implemented thus far. We're keeping their distance, etc., having less people at funerals. The current measures are only an additional. But one goes back to what the government has failed to do. In as much as government says we are introducing lockdown measures, no movement, we have situations in the country, like for instance, I was in Bulawayo, there's no water to speak of. There's no running water on the taps, meaning even if you want to clean your hands, etc., this is not done. The measures around shops, etc., to screen people, that sort of small measures, they're not there. So one feels the government looks at a global, more like we are just going to implement these rules, but the basics are lacking, where they should actually have at hospitals screening, water running, all those measures. They should actually have enforced the current measures instead of introducing a hard lockdown again.
All right. And as we wrap up, our hospitals are coping with the increasing rate of infections.
Well, the reality is the hospitals are incapacitated. They were not able, even in the beginning, to cope with anything. We have people being taken to hospitals, being expected to bring their own medication, being expected to, to, to actually fend for themselves there. So when one talks about hospitals that were or originally incapacitated, the reality is the hospitals are not able to handle anything currently. So the government should actually look at the basic priorities that are necessary. The number that is said, look, a death is too much. One death is too much, but 29 people and 349 deaths. Yes, we don't want any deaths, but the reaction seems to suggest that there was too high a spike. There was a spike. It is not worth introducing a hard lockdown without looking at the other elements. For instance, when you go to the border, which for me, being here in South Africa, is much of a concern, where now people have flooded the border, they are not able to social distance there. The hard lockdown is essentially gained the opposite effect, where now that is now a super spreader environment. But had there be proper planning, because the holidays did not tiptoe on the government to know that people would go home and go to see their families. So better planning should have happened, where instead of just having a sudden lockdown and getting people into a panic mode, better planning would have been provided. At least allow the border situation to allow the movement of people. Now at 6 p.m. the curfew starts, people are stranded there, they will flock together, they will sit together. So it becomes a problem on its own to have a certain hard lockdown. I think the government should revisit how it's doing that, loosen the travel there, and back home, just go back to the fundamentals,
Yeah.
get things working, get hospitals having test kits, get people being able to practice hygiene.
All right. Well, gentlemen, thank you very much for your time. That was ZANU-PF South Africa spokesperson Kennedy Mandadza and Zimbabwe Communist Party spokesperson Bongani Mkwananzi.